Welcome to Magnificent Minds, where we explore the science of child development with both heart and reason, bringing clarity, compassion, and scientific evidence to questions that matter deeply to families. If you have ever found yourself wondering whether your child's challenges are related to ADHD, autism, or something else that seems to sit somewhere in between the two, you are absolutely not alone. This is one of the most common and confusing questions parents bring into my clinic. You might notice that your child struggles to focus, has big emotional reactions, or seems impulsive or dysregulated. Maybe they have difficulty with some social interactions or transitions or sensory experiences. And you have started reading or maybe talking to professionals, and you're trying to make sense of ADHD and autism and what these diagnoses mean. So today, I want to slow this conversation down and bring clarity. Not so we can rush toward a label, but so you can better understand how your child's brain works and how that understanding can guide more effective, kinder support for your child. Both ADHD and autism are neurodevelopmental differences. That means they are rooted in how the brain develops, how different brain networks communicate with each other, and how a child experiences and responds to the world around them. And while they can look very similar on the surface, there are differences in underlying brain patterns and brain function. Understanding those patterns matters because when we understand why a child behaves the way they do, we can respond in ways that support regulation, learning, and connection, instead of unintentionally working against their nervous system. And I want to reassure you of something right from the start. Getting clarity is not about putting your child in a box. It is not about limiting their future. It's about learning how their brain organizes attention, emotion, sensory input, and relationships, so that we can meet them where they are. Now, let's start by talking about why ADHD and autism can look so similar and why many children can have both. And the best place to start is by looking at what we know about the brain. Both ADHD and autism involve differences in brain network formation and function. So it's differences in brain networks, not problems in one specific brain area. This means it's about how different brain regions communicate with each other. In particular, the communication and coordination happening between what neuroscientists refer to as prefrontal subcortical circuits. Okay, so prefrontal to subcortical circuits. So let's talk about brain anatomy for just a moment. The cortex, C-O-R-T-E-X, the cortex, is the outer surface of the brain. And you can think of the cortex as the brain's headquarters, where information from the rest of the nervous system comes together to be interpreted, organized, and turned into intentional action. It is the most advanced part of the brain and the part that is most unique to us as humans. Now, the part of the cortex that is just behind your forehead is called the prefrontal cortex, and it acts like the brain's control center. It helps us focus our attention, think ahead, manage impulses, regulate emotions, and decide what to do next, instead of just reacting in the moment or reflexively. So, to do this well, it needs to communicate with other parts of the brain, especially deeper regions of the brain beneath the cortex called subcortical regions. So, why do autism and ADHD look so similar? Well, it's because they both involve differences in how these prefrontal to subcortical regulatory circuits are working. And that's why we see children struggle with transitions, emotional regulation, shifting attention, or adapting to change. At the brain level, autism and ADHD also have in common certain brain chemistry. Dopamine, which is a brain chemical that helps the brain notice what's important and stay motivated, well, it isn't being transmitted at the same levels or in the same patterns in a brain with autism or ADHD compared to a neurotypical brain. Also, other brain chemicals like norepinephrine, serotonin, glutamate, and GABA, you may have heard of some of these, they are also working differently in both autism and ADHD. All of these neurochemicals help regulate attention, motivation, and learning. What all of the research findings tell us is that autism and ADHD share a lot of common biological features, and that's why they can look similar. You might see difficulty sustaining attention, especially for tasks that aren't immediately interesting. You might see impulsivity, like blurting things out, maybe acting before thinking, or having trouble waiting. You might notice emotional dysregulation, big feelings that arrive fast and take time to settle. Sensory differences are also common in both groups. Some children seek sensory input, like movement, pressure, sound, or visual stimulation. Others can become easily overwhelmed by noises, crowds, or textures. And both ADHD and autism can involve social challenges, but for slightly different reasons, which we'll talk about in a moment. That is why determining diagnosis can be challenging. And it's also why many children actually have both. So, about half of children with autism also have ADHD. So, what are some clues that can help you understand your own child? Well, first, it's important to know that ADHD is a diagnosis that can't be made reliably under the age of 4. So, for children under 4, any concerns about attention or behavior should prompt a full developmental evaluation, not just one for ADHD. Now, autism can be diagnosed as early as 18 months of age, and for some children, early signs of autism appear well before that. Now, let's talk about what you might be seeing in your child's behavior, or what characteristics you might be noticing if your child has ADHD, autism, or both. Let's start with attention. And I'm going to focus on the behaviors we often see in young children because this is usually when determining a diagnosis of autism versus ADHD is most confusing. For some children, attention is very easily disrupted. They can be distracted by what's happening around them, a sound, a movement, or even by their own thoughts. All of these can easily interrupt focus. Sustaining attention on tasks that your child isn't necessarily interested in can be very hard, even if your child understands what to do. But they often have no trouble attending to things they're interested in. This is a classic finding in ADHD. In autism, attention can tend toward hyperfocus, sometimes intensely, on specific interests, topics, or patterns. The challenge is more so about shifting attention. Transitions can be hard because the brain is tuned into a particular channel and has trouble shifting away from it. Now, if both are present, distractibility as well as intense hyperfocus, then both ADHD and autism might be present, or what we call co-occurring conditions. How about when it comes to social interaction? Well, the desire for social connection and relationships is there, whether a child has autism or ADHD. They want to connect and they want friends and relationships. But what often happens in ADHD is that impulsivity, distractibility, or emotional reactivity can interfere with social interactions. A child may interrupt others, miss social cues because they're moving quickly, or struggle with emotional regulation in group settings. In autism, social differences are rooted more in how the brain processes social information itself. So this can include difficulty interpreting facial expressions, tone of voice, or unspoken social cues. It's not so much a lack of desire for connection, but it's a difference in how connection is perceived and understood. Sometimes in autism, the rules of social interaction are learned and then imitated, but the effort it takes to fit in, sometimes called masking or camouflaging, can take a toll and drain energy. Now, there are also communication differences that are more characteristic of ADHD versus autism. So, what's more common in ADHD is talking excessively, maybe interrupting others or jumping rapidly between topics. What's more characteristic of autism is delays in some aspect of language development, differences in the tone of speech, or difficulty with the social use of language, like speech that may not relate to the social context, to what's happening around them, or to what other people are talking about, or tending to use speech in a more repetitive way. Some autistic children speak very little, while others speak fluently. When it comes to more general behavior, ADHD is often driven by impulsivity and novelty seeking. The brain is constantly looking for stimulation. Autism, on the other hand, is often driven by predictability. So, seeking predictable routines, safe routines, unexpected changes can feel genuinely distressing to the nervous system. Another domain to think about is sensory processing. Children with ADHD are often sensory seeking, craving movement, sound, or tactile input, so touch. Autistic children may be sensory avoidant, sensory sensitive, or sometimes both. In some aspects of sensory processing, they may be highly sensitive, like to certain sounds or tastes. But in other aspects, they may seek out sensory stimuli, like smelling certain things or enjoying feeling certain textures on objects. And when it comes to play, children with ADHD may engage in imaginative, creative play, but jump rapidly from one activity to another. Autistic children may engage in more highly structured or repetitive play, often with deep focus and a sense of meaning in that play. Here's a clinical way I often summarize this for parents. ADHD is primarily a condition of regulation and control, staying on track, managing impulses, sustaining effort. And autism can more often be about connection and interpretation, so understanding the world around them and interpreting and processing sensory environments. And when children have both, it's important to recognize this because there are ways we can support both ADHD and autism. Now, you may have a feel for which of these diagnoses best fits your child. And so I want to shift now to talk about how professionals distinguish between these conditions during an evaluation. A thoughtful diagnostic process looks at development over time, not just what a child is doing right now, but how their skills emerged, how they've changed, and in what contexts challenges might appear. This includes a detailed developmental history, behavioral observations, preferably across settings, and standardized tools. For autism, tools like the Autism Diagnostic Observation Schedule, or ADOS, help clinicians observe social communication patterns in a structured way. For ADHD, rating scales like the Vanderbilt or Conners capture patterns of attention, impulsivity, and regulation across environments. So these are just some examples of the tools that might be used. One reason misdiagnosis happens is that early autism can look like inattention or can even look like oppositional or defiant behavior, especially when a child is overwhelmed or struggling to understand expectations. On the other hand, ADHD can sometimes mask social communication differences because impulsivity dominates the picture. This is why it is so important to work with clinicians who are experienced in both autism and ADHD. Clinicians like developmental pediatricians, child neurologists, or psychologists with neurodevelopmental expertise, they can help sort out these diagnoses. And sometimes, after careful evaluation, the answer really is both. And when autism and ADHD coexist, support needs to be integrated. So, addressing only one side of the profile often leaves important needs unmet. Now, ADHD focused supports often include things like executive function coaching, behavioral strategies, and sometimes medication. Autism focused supports very often include things like speech language therapy, occupational therapy, and social communication interventions and behavior therapies. But the right combination of supports really needs to be tailored to your child. And medication decisions deserve special care. Stimulant medications can be very helpful for attention, but in some children they can increase anxiety or sensory sensitivity. Slow titration and really individualizing the care and monitoring closely are essential. Non-stimulant medication options, some you might have heard of like guanfacine or atomoxetine, are also available and for some children can be very helpful. The goal here is never ever to change a child's innate personality, who they are, what they love, what they're curious about, what brings them joy. The goal is to help their brain function with more ease so that learning, connection, and joy can become more accessible. Okay, now this brings us to the real world impact at home and school. At home, you will want to try a number of different strategies, things like clear structure, predictable schedules, reducing sensory overload, and to look for ways to highlight positive natural reinforcement. Ways to provide information and feedback so that your child can understand and in a way that feels positive to you and to them. At school, ADHD supports might include things like movement breaks, visual reminders, and task chunking, or kind of breaking tasks down into manageable chunks. Autism supports might include things like visual schedules, social stories, and sensory accommodations. And if your child has both features of autism and ADHD, it might be helpful to provide all of these. So, when advocating for your child, I encourage you to ask teachers not just if your child is struggling, but how, in what ways. So, what situations trigger difficulty? And also, what helps? Now, this level of detail can make it so much easier to identify whether attention, social understanding, sensory regulation, or a combination of these, or potentially something else, is at the root of their challenges. Now, before we wrap up, I want to talk about something that often gets overlooked in conversations about ADHD and autism, and that is physical health. Because while ADHD and autism are brain-based conditions, the brain does not exist in isolation. It is part of the body. And research consistently shows that supporting the body supports the brain for both ADHD and autism. I want to highlight a few areas where we have very strong evidence that general health supports can make a real difference. First, sleep. Sleep is one of the most powerful regulators of attention, emotion, and behavior. And sleep difficulties are extremely common in both ADHD and autism. Trouble falling asleep, staying asleep, or getting restorative sleep can worsen attention, impulsivity, sensory sensitivities, and emotional regulation. What's important to know is that many ADHD or autism-related behaviors look much more severe when a child is sleep deprived. So supporting consistent sleep routines, predictable schedules, calming bedtime environments, and addressing any medical sleep issues when needed can significantly improve daytime functioning. Second, nutrition. Now, there is no single ADHD diet or autism diet, but research does show that the brain needs consistent fuel to regulate well. And irregular meals, highly processed foods, and large blood sugar swings can worsen attention and emotional reactivity. Many children with ADHD or autism are picky eaters, So, nutritional gaps are common. Supporting regular meals with adequate protein, healthy fats, and micronutrients, and addressing deficiencies like iron, vitamin D, or B vitamins when present, can help stabilize energy and attention. This isn't about perfection, it's about reducing stress on the nervous system. Third, movement and exercise. Exercise is one of the most well studied, evidence based supports for brain regulation. Physical activity increases chemicals in the brain that support attention, mood, and learning, including dopamine and norepinephrine, which are especially relevant in ADHD. Now, for autistic children, movement also supports sensory regulation and body awareness, which can be so helpful. Regular physical activity, especially activities that involve rhythm, coordination, or deep pressure or heavy work, so input into the joints and muscles, these can help the nervous system feel more organized. This doesn't mean structured sports are necessarily required. Sometimes that can be difficult. But things like walking, climbing, swimming, biking, dancing, all of these count. Fourth, sensory and lifestyle regulation. Now, both ADHD and autism involve nervous systems that can become overwhelmed more easily. Busy schedules, constant screen exposure, and high sensory load can increase dysregulation. But creating predictable routines, allowing for downtime, and reducing sensory overload when possible, as well as building in moments of calm and moments for movement breaks, can help the brain stay in a much more regulated state. Finally, stress and connection. So, chronic stress affects the brain systems involved in attention and emotional regulation. Supportive relationships, emotional safety, and feeling understood matter enormously, not just emotionally, but actually biologically. Because when a child feels safe and supported, their nervous system works so much better. So, the big takeaway here is physical health supports are not extras, they are foundational. Sleep, nutrition, movement, routine, stress regulation, safety, and relationships. Now, these don't replace therapy or educational supports, but they should be part of them. They make every other type of therapy work better. For both ADHD and autism, supporting the body is one of the most powerful ways we can support the brain. Here's a quick checklist that might be helpful to you. So, is my child getting enough predictable sleep? Do we have a calming bedtime routine most nights? Is my child eating regular meals and snacks? Is there some protein or healthy fat most of the time? Does my child get daily movement that helps them feel calmer or more focused? Are we using movement as support, not necessarily a reward? Is our day predictable enough to feel safe? Are there times when things feel too loud, too fast, or too much? Am I leading with connection before correction? Do I have support myself for my own well-being and regulation? And instead of, how do I stop this behavior or this problem, ask, what helps my child's nervous system to feel regulated? As we wrap up, I want you to remember getting to the right diagnosis is important, but at the same time, diagnosis is not the destination. It is a doorway. Because once you understand how your child's brain organizes the world, you can choose environments, strategies, and supports that align with how they learn best. So this week, I invite you to observe your child. Notice what helps your child feel calm. Notice what sparks curiosity. Notice what supports connection. Those moments are your roadmap. Autism and ADHD can look alike because they have common neurobiological features. And many children experience aspects of both autism and ADHD. And when we understand those nuances, we can offer care that is more precise, more compassionate, and more effective. And I'll leave you with this question to reflect on as we close. What would it look like this week to see your child not through the lens of a label, but through the lens of how their mind shines. Thank you so much for being here. My hope is that these conversations help you feel more informed, less overwhelmed, and more connected to the science, to your child, and to a community that's learning and growing together. If you found today's discussion helpful, please share it with another parent or professional who might benefit. And as always, I appreciate you being part of this journey toward understanding and supporting every child's unique path to thriving. Until next time, take good care of yourself and your family and keep believing in what's possible.